Let's talk about the consent advice. When you take the consent, coming over to the risk associated with that procedure, you need to explain the risk and what measures you're going to take to cover that risk, right? So this is important to tell to the patient. Like suppose we are talking about surgical termination of pregnancy. So in that situation, you have to tell the patient that there are certain risks associated with the procedure. There are some frequent risks, like there is a risk of bleeding. So what we do, we keep some of the injections ready and we give it to you to control that bleeding. Apart from that, there is a risk of infection. So before taking you to the theater, we give you one antibiotic to overcome that infection usually. Then there are some serious risks associated with the procedure. Sometimes the product of the pregnancy products, they may retain inside, or it is not a complete procedure, or sometimes it's a failed procedure, but take proper measures to overcome this. And apart from that, there is a serious risk associated that when we do the procedure, though it's in the expert hands always, but your womb sometimes may give away and it can get perforated by the instrument because of the softness due to the pregnancy hormone the uterus is having. If all that happens, then we may need to see that it's not bleeding internally, or it has not injured the other tummy, it's not bleeding. And if at all we find that any bleeding is happening, we may repair the organ, the womb, or if there is any gut or bladder injury, then we repair that at that time. Sometime we may need experts, and sometime a bigger cut may need to be given over the tummy, over the lower tummy. But you also have to tell the patient that these are the risks associated with this, and after that you have to explain everything about those risks, how you're going to handle it. Then you need to tell the patient about the alternatives. So at the place of surgical termination of pregnancy, you can tell that you have the alternatives, the medical management, that you have to explain the risk. There is an option of no treatment also, like if you don't go for any of these procedures, then you can carry on with the pregnancy and give the baby for the adoption. In the end, you need to tell the patient that she can, if she wants, she can go through the consent paper. You can give her a copy as well, and you can tell her if she agrees to that, she can sign it, and you also sign the copy. And then you tell her that after, in the next meeting, anesthetic doctor will also meet her, and if required for the anesthesia part, and like that you can end the station.